Hey everybody, it's Dr. Rittenhouse from Bue Mountain Wellness, and I'm here with Samantha. She is going to do a foot scan today. So I'm just going to tell us a little bit of information about what the foot scan is, why we do it, and then what these things are, because this is what it's all about. So basically the foot scan, I'll show you over here, this is the foot scan machine, which you'll see in the corner of the waiting room if you come in. The foot scan that we do is totally free to do, but what we do is we use that as an assessment to see what changes there are with your feet. A lot of people deal with things like collapsed arches, less support from the feet, and it's really vital to assess this type of information, because if we know that there's an issue with the feet, that can cause a lot of problems up the line with your ankles, your knees, your hips, even into your back, which is obviously relevant in the chiropractic office. So what this is the orthotic. The machine gives us an idea of how much change there is in the foot, and the orthotic is what we put in your shoes as a way to correct those changes if there's any problem with your arch. So a lot of people, once they get through into adult ages, have this arch collapse. So we want to make sure we can assess that and make sure that's part of your wellness approach here to make sure we get you balanced and ready to go as good as we can. So then we're going to have you come over here and do the scan. So I'm going to have you start simply by taking your shoes, your socks off, if you have them on. That's all right, and you just want to center your feet in these clear spaces. So your left side goes over here and your right side goes over here. All right. And use your language. English, I don't want to assume, but we'll go from there. And then we just hit get started. So simply click that, it'll show with a keyboard, and we will type in your information. So this is something that patients can come in with if they're just interested in the foot scan, but a lot of times we include the orthotics in the scan as part of a chiropractic treatment plan, because often patients come in for other issues, not just foot pain, not just knee pain or back pain, and we want to make sure we're addressing the body's needs on a whole scale. So this is something that we'll often include in a whole chiropractic approach. Just choose whichever ones are most relevant. Good. So for this part, we want to make sure that these are rolled up so they don't interfere. Yeah. There we go. Awesome. And then you just stand as still as you feel like you need to. You can hold on to these if you want to balance, and then just try and stay still. It only takes a few seconds. But what the scan is doing here is it's getting a laser image, plotting thousands of little points along your bottom of your feet, basically making a map of what the bottom of your foot looks like. And based on that, will give us an assessment of how much collapse the arch has and if there's any balance issues going on there. You're doing great. Perfect. All right. So you don't even know what that means yet.
I don't know. It doesn't look good.
Right. So now I'm going to have you turn your whole body, face the wall away from me here. Perfect. Yep. You don't have to worry about the clear spaces on the bottom. And so you just stand like you normally would. Try not to think of your perfect posture. We want an honest look. And so what this part is of the scan is taking a postural assessment photograph so that it gives us an idea of how much the foot problems may be assessing spinal posture overall. All right, so at this point you can step down, you can get your shoes back on, and then I'll have you come over here. I'll just give you a quick little crash course. So basically the scan puts out general information, and there's a more detailed report that gets sent to my computer. What I can show you here, what it does is it shows us what the patient's foot looks like here compared to what an ideal scan should look like. And you can see it doesn't take much to notice there's a huge difference. So we have a lot of increased red. That means there's a really significant amount of loss of the arch height. And this is a very typical thing that we'll see, which means that orthotics are something that really could help her. So it's relevant whether you're just someone who has foot pain or just back pain, or even especially if you're on your feet for your job or you have any exercise athletics that you do on a regular basis. This is the type of thing that can really get you back to balanced, get you feeling good, and get you right.